The construction industry continues to experience a disproportionate number of work-related fatalities when compared to other industries in the United States. There are several studies that have highlighted the importance of attention in reducing the number of injuries in the construction industry. In fact, if workers are distracted or lack attentiveness and situation awareness, they cannot identify and properly respond to a hazard. However, we do not have proper scientific evidence to show where construction worker attention falls short. To empirically measure the attention of construction workers, eye tracking techniques can be implemented which are widely accepted as the most direct and continuous measure of attention. In the past decade, use of eye tracking has flourished in studies related to human-computer interaction, usability research, advertising, visual design, driving, psychology, aviation, sports, and now construction safety. 31 construction workers were recruited for a laboratory experiment to record eye movements using a head-mounted iLink 2 system. Participants were presented with 35 construction site images, ordered randomly, each of which showed multiple hazards varying in safety risk. Each image was displayed for a maximum of 20 seconds, and workers were instructed to screen each image, searching for any hazards. Simultaneously, their eye movement and search strategies were monitored lively. Right after each image presentation, the workers were asked about number, type, likelihood, and severity of hazards which they have identified. Some of the independent variables that were collected are working experience, 0 to 5, 5 to 10, or 10 plus years, injury exposure, whether has been injured or has seen someone get injured, and training, has OSHA 10-hour certificate or has informal or on-site safety training. The impacts of these variables on workers' attentional allocation, cognitive process, and hazard identification were studied. The results demonstrated that working experience and past injury exposure significantly impact a worker's search strategy and attentional allocation. However, there was no difference in search strategies and attentional patterns of workers with or without the OSHA 10-hour certificate. This can be alarming for construction safety professionals, since it implies that the most common and basic training may not improve workers' hazard detection skills. While the results do not state that the OSHA 10 hours is ineffective, they do call for development of innovative training techniques that can improve workers' hazard detection skills. This study is the first attempt to use eye tracking to measure construction worker attention. Results from the study may help to test training effectiveness, identify workers with poor attention, and pinpoint training opportunities to reduce human error and accidents in construction sites. This research is a collaborative effort between Safety Risk Management and Decision Making, SARMAD Research Group, the Vision, Attention, Memory and Perception Lab, and the Center for Brain, Biology and Behavior, CB3, at UNL.